There's nothing quite like good mornings spent with your family. It makes you recharge to go out and face the day. It makes you feel that today is going to be a great day to set our lives in motion. It makes you feel hopeful that things would go smoothly and function well. It makes you ready to go out and claim victory. I'm glad I get to spend morning rides with my daughter. It's always a relief to have her company before I get to work. Sending her off to school with a happy smile always puts me in the best mood. I'm excited to get to work today. After all, a good night's sleep makes you feel great. My jobs can be challenging sometimes, but the people I work with make it easier. We always uplift each other when things get tough. I work with a diverse group of people with different skills and different stories. There's Don, who makes every moment count, both here at work and when he's home. Melissa, who you can always count on to keep cherished memories and beyond. And Nita, who holistically improves the spirit of everyone here in the office. We work hard on a variety of things, which is why I boost my immunity so I can be healthy in mind and in body to keep up daily. Most days, we are confidently in control of any situation here at the office, making sure that we reign over challenges together, that we move with a common purpose, that we put first things first even when we are at work, and strive to strike a balance between our work lives and personal lives. So when we go home after a productive day with ease, we can find our inner stability. Live our lives to the fullest with the ones we love, and behold calmness so we could live every day with a healthy state of mind and body.
Before we formally open this event, we would like to put down some reminders. This presentation is being recorded. During the duration of this webinar, kindly turn off your camera and keep your microphones on mute. For questions and clarifications, please type your concerns in the chat box. Our moderator will go through the questions during the open forum. Also, please remember to fill out the evaluation forms before leaving the webinar. A link will be provided in the chat box later. Even the best doctors have their limits. There are days when all the pressures and stress from the toxic work environment build up and weigh us down. For our second plenary session, we will be focusing on mental health among physicians, how it can affect their attitude towards patient care, and most importantly, how it can be managed. Let us welcome Dr. Maria Annette Bautista for this session. She is a practicing neurologist and psychiatrist in Nueva Ecija and a graduate of the University of Santo Tomas Neurology Psychiatry Training. She is a Life Fellow of both the Philippine Neurological Association and Philippine Psychiatric Association. She is a past president of the Philippine Neurological Association and is the current president of the ASEAN Neurological Association. This will be moderated by Dr. Ovidio de Leon, a fellow of the Philippine Psychiatric Association and Philippine Neurological Association.
Good morning, everyone. I'd like to thank the organizers of this event for this invitation. It's a timely topic on stress and healing. This is about when healers need healing. All right, physicians are no superheroes, so most doctors never take any sick days off, actually. And the culture brought to us is that MDs are trained to be tough, but patients must understand that doctors are humans too. So this study of stress among healthcare personnel by Kushal et al. In 2018 is a six-week survey, questionnaire based, which showed results according to age. So for the 20 to 30 years old, there were 58% showed stress symptoms. 30 to 50 years old, 56%, and greater than 50 years old is 62%. Gender and marital status were not as important. There was not much difference whether married or males or females. Work related stress, you could see a 59% moderate stress seen in healthcare workers, but most, like, or some, 41% showed safe level with good coping mechanisms for stress. Health status showed that 62% of this population manifested with stress associated symptoms. Now, this is very interesting. Take note that this is a study by Medscape published in January 2020. So this was pre-pandemic among medical specialists who feel most stress. And this is in the US. Urology topped it with 54%, neurology 50%, nephrology 49%, diabetes, endocrinology 46%, family medicine 46%, and surprisingly, radiology 46%. It would be interesting to know the results during the pandemic. Now, among the specialties which had the lowest rate of burnout, according to Medscape last year, public health 29%, OFTA 30%, orthopedics 34%, psychiatry 35%, otolaryngology 35%, and general surgery 35%. I would imagine that having a study right now would actually put auto and ophthalmology probably on the top list, and psychiatry towards the latter part because of the increase in mental health concerns of all populations. Here is a local study on COVID-19. What was the psychological impact of the pandemic in the Philippines? Greater impact was seen on females, youth age and students, single status, recent imposed quarantine, prolonged homestay, poor health status, unnecessary worries, and discrimination. And those who manifested lower level of anxiety are those with adequate health information. They do understand, they have grown-up children already, they are confident in doctors' abilities, and they have good health. But in this population of 1,879, 25% already had moderate to severe anxiety, and 1/6 of this population had moderate to severe depression. Now, what's the effect of this COVID-19 also on mental health status? Kaminsky states it's akin to what people might experience during the prolonged war or refugee crisis. So this chronic period of elevated stress has acute exacerbations. And what's difficult, it's murky. The endpoint is very murky. So it makes it even more difficult for healthcare workers. Now, let's review now in this study of the top 10 specialties treating COVID patients. The top 5 are, this is a study in the US, emergency medicine, nephrology, critical care, infectious diseases, and pulmonary medicine. Now, what makes it more difficult is the multiple stressors with little relief. The exposure to life or death situations daily, especially during the March to June, shortage of supplies, rapid deterioration of patients, and we were conduits to video calls between relatives and patients. There was that feeling of hopelessness, and political disagreements even added more, as well as the stigma. Now, loneliness was also studied. In fact, there are many workshops now for loneliness in the American Psychiatric Association. Why? Because it has affected many and different countries, including the Philippines. This study shows that loneliness due to stay home protocol. And not only that, you're quarantined, you're not even able to talk with your relatives inside the house. So it has affected from the United States, Brazil, France, Germany, Mexico, Portugal, Spain, and the United Kingdom, 30 to 40% and above. Then that's quite high. We can't remove also the effect on medical practice. This was published in JAMA, June 2020 by Rubin. There was a steep decline in revenues in small private practices. And it was a difficult shift to telemedicine, especially for those who have not been into technology uh, the last few years. And there was this lack of the clinical eye because you have to depend on laboratory and radiologic workups. A survey of 50,000 US physicians showed a 60% drop in visits to ambulatory care practices. And though this increased already, gradual increase of the patients, but there is also a one-third lower uh, rate compared to the pre-pandemic time. What are the unintended consequences of infographics and virus information? People got scared of doctors' offices. Patients would rather die than get exposed to the coronavirus. Fear prevented people from seeking medical care for symptoms requiring medical attention like MI, stroke. So they'd rather stay home, or appendicitis for an acute abdomen. Now, this is a study of the income change since the start of COVID-19 by Medscape in September 2020 among the different countries. So you would see a marked decrease in their income from 62%. Only Spain manifested a lower rate of 31%. So all of this adding to stress. What is stress? Stress is a pattern of specific and non-specific responses an organism makes to stimulus events that disturb our equilibrium, and it exceeds our capacity to cope. So we're able to cope to stress daily, but we have the prefrontal cortex that dictates a trauma that we get when we suddenly feel vertigo in a public place and you lose consciousness, for example. So you're scared, you become hyper alert after this, it becomes a stress. Stress accounts for 60% of doctor visits, but please remember that doctors are not spared of stress-related disorders. Acute stress may lead to chronic stress, then to burnout, then to depression. Now, what is the recipe for stress? We have key ingredients here, according to the Center for Studies on Human Stress in 2019. We have several threats like novelty, the emotion of which will be it's something you have not experienced before, hence you feel fear. Unpredictability, something you had no way of knowing it would recur. Then a threat to our ego. So if you're under training or if you're into a new environment abroad and you have a question on your competence as a person, when it's called into question, it gives you stress. And then a sense of control. You feel you have little or no control of the situation. All of these are recipes for really bad stress for us. It was Mr. Hans Selye in 1920s who pioneered the field of stress research. According to him, there is a general adaptation syndrome. The stage one is the alarm phase. At first, the experience is very stressful. It's something new. And then one enters a period of chronic, unabated stress. You lose your job, you have a divorce, you have a death of a loved one, or you're entering into emergency medicine, for example, a training of a harsh working environment, for example. Then you enter stage two, the resistance phase. Then one gets used to it, and you enter now stage three, the exhaustion phase. And finally, one cannot stand it any longer. So here you have developed now hypertension, mild cognitive impairment, depression, suicide, and other diseases related to stress. A stressful event can trigger a cascade of stress hormones that produce well orchestrated physiological changes. When it becomes chronic, it's repeated activation of your stress response, thereby leading to an increase in your blood pressure and a promotion of the formation of artery clogging deposits. And in your brain, you develop anxiety, depression, addiction, and obesity, actually. Now, what is our stress pathway in the brain? It involves several areas. It involves our frontal cortex, thalamus, hypothalamus, our amygdala, our pituitary, and down to the adrenal glands. Okay. So we have a fast pathway where we don't need a cognitive effect yet. So we have like you get a dog barking at you, you get scared, you run. That's an automatic response. When there's a fire, you have an automatic response to run, okay, without thinking, actually. But there's also the slow pathway. In normal conditions, acute stressors would stimulate your amygdala and hippocampus to stimulate the hypothalamus to release corticotropin releasing factor. This will thereby stimulate the pituitary gland to release adrenocorticotropic hormone, thereby also stimulating the adrenal cortex to release cortisol or glucocorticoids. Then this will have a negative feedback to your brain to actually inhibit the release for the release of corticotropin releasing factor. So, dapat magno-normalize siya no, after a stressful event. It also has an effect on mast cells, no, which will thereby reduce your immune system. But always, this is a negative feedback kasi dapat matatapos siya after an acute stressor. But what happens sometimes is you have the acute stress becoming chronic. It becomes daily, it becomes weekly, all right? Now, then it takes its toll because of environmental stressors and internal stressors. Environmental stressors are the stressors in your work condition, your family, in different aspects of your life. But internal stressors are also how we develop our coping mechanisms, our personality. Are we the dependent type? Are we the narcissistic type? Are we actually anxious type? Okay. Now, it has an effect on the nervous system, the endocrine, and the immune system. So there's a release of noradrenaline and adrenaline, which may later on lead to adrenal fatigue. And not only are we releasing ACTH in the hypothalamus and the pituitary gland, but we also release TSH and increase in thyroxine, thereby increasing our heart rate, respiratory rate, blood pressure, metabolic rate, and blood flow to our extremities. And then we have a disturbed circadian rhythm. So our sleep-wake cycle is disturbed. And then we have an increased appetite because of the quick need for energy. And then we have excess glucose stored as fat. Then also fatty acids will lead to overproduction of LDL. And then we have a diminished progesterone. Then it may lead to infertility or decreased sexual libido. So this we also have effect on the brain. Promoting cell loss or cell death and eventually leading to dementia. So there are also gastrointestinal effects. We have had so many patients seen by many gastroenterologists because of GERD, all right? Bloating, hyperacidity. It actually disturbs or alters our microbiota. So it increases the stimulus to the vagus nerve at the sympathetic nervous system and also increases cytokines also by the HPA axis. And these are pro-inflammatory and alters metabolism in the liver and also likewise alters tryptophan metabolism. And this is a precursor to very important substances like serotonin and melatonin, which is needed for regulation of mood and sleep. Now, chronic stress, in summary, has effect on our glucocorticoids, is increased. Okay, then we also have the glucocorticoid response dysregulation and increase in pro-inflammatory cytokines. This will lead to an altered GABAergic neuron population, which is inhibitory to our neurons. If you have a decrease in GABAergic regulation, you have an unbalanced signal transmission in the circuitry of the brain. Likewise, if you decrease your glutamate, which is excitatory, then you have a decrease in neural activation, also further giving unbalanced signal transmission in the brain. You also have nitrite oxide synthase decrease, and this will decrease your nitric oxide and carbon monoxide, which are vasoregulatory, and decrease vasodilatation, and also disturb your hemodynamic response in the brain. It also has an effect on the microglia and inducible nitric oxide synthase, increasing neuroinflammation and irregular metabolites of nitric oxide, which are neurotoxic. So, burnout is an end stage of chronic stress. So it's a state of mind that comes with long-term unresolved stress. It's common in 25 to 44-year-olds, but actually we see it until 65 to 70-year-olds because doctors don't retire. Loss of meaning in one's work coupled with mental, emotional, or physical exhaustion as a result of long-term unresolved stress. Now, what is the prevalence of burnout in the US? Okay, this was done since the COVID-19. There was a 64% increase. It was more intense during the COVID-19 in this study. Now, this was first described, burnout, by Freudenberger in 1974, it being a state of exhaustion that results from failure, attrition, loss of energy and power, or unfulfilled wishes on human internal resources. It's three-dimensional in syndrome: emotional exhaustion, depersonalization, and personal accomplishment is affected. First stage, emotional exhaustion, is feeling of being tired, emotionally worn down, and feeling of being overloaded in the job. Depersonalization is understood as cold, indifferent, rigid, or even inhuman attitudes expressed towards other people while at work. Kaya sometimes we become masungit, no, to patients or even our colleagues as well. No? Personal incompetence. It's when one considers himself as inadequate and unsuccessful in his or her job and personally full of feelings of failure. So very negative. So this harbors depression in the future. These are the 5 stages we go through in burnout. All right. We'll go through them one by one. This is from the honeymoon phase to the habitual burnout. Honeymoon phase, all right? So you will relate to this. You experience this when you're in your new job as a doctor or in your new fellowship training probably. Okay, you experience predicted stresses of the job. Alam nyo, mahirap. But the common symptoms at this time, very committed ka to the job. You have the compulsion to prove oneself. You have sustained energy, free-flowing creativity, high productivity. Okay na okay ka dito sa honeymoon phase. Now, when stage 2 gets in, that's the onset of the stress. You become aware that some days are more difficult than others. The optimism begins to wane. And here comes the common symptoms of anxiety, fatigue, parang kulang ka na sa tulog, even if you have the time to sleep. Avoidance of decision-making, hindi ko kaya yan, ikaw na lang gumawa yan. Forgetfulness, so your responsibilities you forget. Change in appetite. It's either you increase or decrease your appetite. Then you develop palpitations and sometimes increasing your blood pressure and you're not able to focus, and then lower productivity. So when you're like this, sometimes mapapagalitan ka na ngayon, no? By your coworkers, your colleagues in your department, for example. Now, chronic stress is stage 3. Marked change in stress levels. Common symptoms at this point is anger. Medyo madali ka na magalit, apathy, you have a decrease in sexual desire, and you have the tendency to increase your alcohol intake or caffeine intake or consumption. And there's the persistent tiredness. Kakagising mo pa lang, you're already tired, okay? And you miss work targets already. You procrastinate. So delay and delay and delay. And then you socially withdraw. And now you have some physical illnesses. You get fever, you get headaches, you have a lot of barrage of physical symptoms. It is at this point that we need to seek help already, ventilate, bring it out, and accept that you're into something that you're not used to. Burnout gets in at stage 4. The common symptoms at this point is already chronic headaches. So, madalas na kayo magpatingin sa colleagues nyo for your headaches, for your GI problems, for some other symptoms, difficulty breathing. So, there's a complete neglect of personal needs, no? And you feel empty. Happy ka naman, you have a good family, para kang masaya naman, but it's deep inside, it's not, no? It's just outside. And there are obsessions over problems at work already. You have self-doubt. You feel that you're not doing your best. You're very pessimistic, and even more physical symptoms. Okay. Now, stage 5 is already the habitual burnout. These symptoms now are so embedded in your life that you are unlikely to experience a significant physical or emotional problem. So dito, you're already feeling numb. So when you talk to these people, no, even my colleagues, this is the common uh, complaint they say, I feel numb. What are the common symptoms at this point? Depression already gets in. It's chronic sadness, no? And it's chronic mental fatigue. So this already will affect the output of your work, your occupation, and you call this the burnout syndrome. Now, it's so easy to say, distress ka lang. What are ways to distress? But it's very important to understand how to distress. Actually, me as a psychiatrist, I have done a lot of research now, and now I'm trying to apply it to myself, because sometimes we say, wala lang yan, corny naman yan, trying to distress. But I have found myself already into the stage 3. So that's why I'm enrolling myself now into mindful meditation. There's so many books, reading materials that you will see, like WHO came out with Doing What Matters in Times of Stress and Rewiring Your Anxious Brain. There are a lot more reading materials, but what's important is doing some techniques, all right? Like breath focus, long, slow, deep breaths. Body scan is progressive muscle relaxation, imagining you're relaxing your muscles from your toes up to your head. Guided imagery is picturing something that relaxes you, probably a beach, a garden, plants, butterflies, birds. Mindful meditation, which I will discuss later, you can go actually into yoga, tai chi, or qigong, depending on your age group and what will suit you well. And repetitive prayer. The spiritual aspect right now has to be there. It doesn't have to be memorized prayers of whatever religion, but it's trust and praying and trusting each day to Him. Now, this is one of the examples. It's a mindful STOP, stop, by Dr. Pang. And he states here that S is stop any business temporarily, just 10 to 20 minutes every day, and invite our attention to rest on the present moment. T is to take 3 slow, deep, and mindful breaths. O is to observe and label 3 sounds around us. It may be the sound of the fan, or the wind, or the bird, or probably a car moving, and paying curious attention to what we see, we touch, and what we hear. So meaning, it's blocking actually, okay, I have a lecture for tomorrow, or I have a report to make, or I have a court case tomorrow where I am witness, or I have a barrage of deadlines, or whatever. You have to break it and stop it and filter for 20 minutes. P is to proceed. After 20 minutes, with whatever we need to do, okay, proceed now mindfully and with a smile. So you have to really shut down, in other words, for at least 20 minutes. This is what my example of mindful meditation. I love the beach and I miss the beach. And it gives me, I have a mental picture of this beach. It relaxes me when I do this 10-20 minute stop from all the work I do. Or this can be another scenario that you can imagine. Now, inner peace meditation actually has been used no, and practiced in India for thousands of years. So this is a mantra meditation. It reduces stress and calms the mind and increases inner peace. So in other words, it's actually a discipline and trying to cut down on the stress that we see on every situation so that we do not stimulate our hypothalamus, our amygdala, our hippocampus, our pituitary gland to release all these stress hormones. In the 1970s, Harvard University studied transcendental meditation. It's a relaxation response by the body to give the body deep rest. It builds up the body over time, deepening the reservoir of rest. Now, another thing is workplace. The workplace that we are working on should have activities offered to our clinicians and healthcare workers. In a study also shown by Kane in September 2020, even in the United States, United Kingdom, Portugal, there's quite a small uh, percentage of activities offered for clinician to deal with grief and stress. Now, I got this from Rush University Hospital. It was a project they did in April 2020 where they had 5 key resources to manage mental health and enhance well-being of physicians and healthcare workers. They created wellness rounds, the sole mission of which is to take care of the healers. No? So there's a wellness response team who goes to target areas, for example, the ER, ICU probably, the COVID areas, where they check on the mental health of these healers. We have wellness consult services also recommended, like counseling services, enhanced and managed by trained counselors, psychologists, and probably psychiatrists. And they also have the Wellness Plus, where psych referrals are necessary, wherein are available for mental health crisis, because there's nothing wrong in seeing your colleague psychiatrist. In fact, it would help ventilate. The mere talking to a psychiatrist would actually not judge you against seeking help, you know. Kasi tayo, takot kasi tayo, baka ako ma-judge when you see. But I could see that many people now are calling me colleagues actually because of this burnout. And it's nice also to have a wellness resource hub. In this hospital, they had a 14 feet projection wall, no, of a waterfall with soothing music, and they had healthy snacks available where our colleagues, doctors, or healthcare workers could sit down and just relax for 10-20 minutes inside, just to recharge, and also creating a well-being after the pandemic. So even after the pandemic, this is actually necessary also, so that we could assess, because we could not see sometimes symptoms in front. No? They don't manifest as sadness anymore. And mind you, there is a 200% rise in suicide cases in all aspects, whether engineers, doctors, um, teachers, and students as well. Now, always remember, courage is having the guts to ask for help. So we as doctors must be honest to ourselves about our own vulnerability, so you can be more self-compassionate and understanding. And there's nothing wrong in discussing your inner thoughts with trusted colleagues, so that we can foster also deeper connections with them. And this makes us human, our imperfections. Now, what are the tips for stress-free life? We have to follow a routine. So in the morning, taking your coffee, having wake up early, make a list for yourself, no? Para guided ba tayo? Include also there your 20-minute shutdown. Accept and face challenges. Sometimes kasi meron na tayong negativity in a certain situation. So in every day to day, it's how we look at, it's like, for example, looking at math as a difficult subject. So meron ka ng judgment in yourself that this will be a difficult day kasi may math ako. Or when, okay, when I go, I'll have too many patients and then makaharas na naman ako. So may negativity ka na kaagad. Look after yourself. We have to see the cues that we're getting tired. Avoid distractions. No? It makes it difficult when you're working on one, then you have a distraction because you're multitasking. Relax, focus, and don't procrastinate. Make a list nga. Priority muna, ito muna. So dito muna ako magfo-focus. Then I'll finish it on a certain deadline. And don't forget to exercise. We always recommend that to our patients, but we have to do it. It doesn't have to be long exercises. Nike Training Club has like 8 minutes, 10 minutes exercises that is age-friendly. So you just have to input your data. And lastly, most of all, always remember to be happy and never forget to live. This is my last slide, and thank you very much for listening.
Learn from our experienced clinical experts regarding the approach and management of common disorders we see in internal medicine. You may refer back to our website at www.tiktok2021.com and choose which breakout room you would like to join.